takes more than 12 hours to drive across Texas, a big state where abortion is now unavailable.
I'm Dallas, Texas.
Tiana Smith came by plane.
My homegirl had found this program to help me, so they paid for my flights, they paid for my hotel, and they paid for the rental car.
She flew all the way to El Paso, then crossed the state line into New Mexico to get abortion medication.
It's like, how can you make that decision for me? How can you make these decisions that's going to affect my life in the long run? I just don't feel like it's fair, and it's not right.
Many more come by car.
I drove 10 hours.
Since the U.S. Supreme Court overturned the abortion rights case Roe v. Wade, New Mexico is now the only state bordering Texas where abortion is still legal.
It would have been easier to go to Louisiana because they're 3 hours away, but they wanted you to go to one appointment just to talk to a counselor, and then another appointment to have an ultrasound, and then another appointment to have an abortion.
Anti-abortion activists are celebrating a decision they say will save human lives. But in Santa Teresa, New Mexico, at Dr. Franz Theard's Women's Health Clinic, the phones are ringing off the hook, seeking abortion services.
We've got as little as 100 patients a month to 269 patients a month. And I think the past 2 months have been over 200, so I suspect it's going to trend that way.
Out-of-towners from the Lone Star State may bring a Texas-sized demand curve for abortion care services in New Mexico. That's because the population of Texas is more than 29, around 2 million.
55,000 abortion patients in Texas last year and about 11,000 in Colorado, right? And fewer than that in New Mexico. So that's potentially a 5 times increase in the number of patients traveling from out of state, which is going to have ripple effects across our entire state healthcare infrastructure.
Abortion rights activists say Texas already had strict laws on the books, setting a total ban will overwhelmingly affect Black and brown women and undocumented migrants.
But the reality is folks are majority working class, and having a child is incredibly expensive. And a lot of folks have different reasons for why they need to seek abortion care, which is a medical procedure, and the government has no business sticking their nose in.
Mostly Texans now fill Theard's waiting room for a consultation and prescription for abortion medications, misoprostol and mifepristone.
It's an undue burden, and they shouldn't have to be. Not in 2022, but we're going back.
Theard was early on in his medical training when Roe v. Wade legalized abortion nationwide in 1973.
It took 50 years for the pendulum to swing the other way, and I hope that it doesn't take 50 years for us to regain reproductive rights.
At the tail end of his career, a constitutional right for women is gone.
The pro-life people have been doing it very gradually over the years. I think the pro-choice people were complacent.
Theard says he will help people access abortion care as long as he can.
It is a sad time for the country, and we're going backwards in everything, from that to voting rights to everything. What's coming to this country, I don't know.
And Texas women will likely keep crossing a state line to get abortion care.
Yeah, I've seen a lot of females, a lot of ladies in here, but it's like you never know their story. You never know what they're going through, and so I support all women. I feel like if they feel like that's what they need to do, that's what they need to do. I'd rather somebody to not have the baby than to have it and to just not care for it. You know what I'm saying? So, yeah.
With the overturning of Roe v. Wade, Texas has a trigger law that will effectively criminalize abortions in less than 4 weeks' time. The incumbent governor here, Greg Abbott, a Republican, fiercely anti-abortion, heralding that decision, also claiming the state will increase Medicaid funding for maternal and prenatal care. That being said, CDC data isn't exactly kind to maternal mortality rate observations here in Texas, really ranking African-American women towards the bottom. He is up for re-election in the fall. His opponent, a Democrat, Beto O'Rourke, is vowing to repeal the abortion laws here if he's elected. Chance?